Acute pain is the pain that starts with an injury. For a classic example is surgery or a sprain. You fall down and you get a pain. And it heals when the healing occurs. So when the surgery is over, then after 3-4 weeks, the healing peaks, and generally 6 weeks is, they say, is the surgery pain is healed completely. At that time, the pain should disappear. And so if it does, then it's called as acute pain. Why do you want to know about this? Because acute pain is such pain that it involves the whole systems, all the systems in your body, everything. You can have a pain in your arm, but it will affect your heart, it will affect your kidney, liver, everything, because the kind of a pain that is very intense. So it changes the whole systems. And so the doctors tend to treat them as more aggressive.
A really big cornerstone of physical therapy, in my experience, is education. Education is very, very important because there are so many things a patient can do to manage their pain that sometimes they don't know. For example, this thing called posture that your mom probably talked to you about, right? You have bad posture, you've had bad posture for a long time. I think one of the questions was somebody had pain since they were in first grade. So, who knows what kind of habits they developed over the years where the pain sort of just got worse and worse. So, posture can affect pain, pain can affect posture. Physical therapy for pain, how does it really work? One of the things that physical therapy works is by reducing the actual mechanical pressure on the pain receptors. The pain receptors are triggered how? By some pressure on them. Usually it could be swelling, it could be a tear that has caused swelling. So something has disrupted that normal ecosystem in that area where the pain receptors have reached that threshold where they fire their electrical impulses, and it goes races on to the brain where it is then interpreted as pain. So by reducing the swelling, we also get to promote some healing in that area. Again, if it's a post-surgical case, the swelling can actually impede healing. And by reducing swelling, by using different modalities and movements and exercises, it can improve the blood flow in the area, flush away all the, metabolites from there, and bring in fresh nutrients to do the healing.
What kind of pain the physical therapy does not help? And doctor sent to physical therapists when you mention you have pain.
Well, in physical therapy, we usually the pain is a little bit more tangible. There are some very intense pains that I don't think physical therapy can effectively address. Organ pains are really hard for physical therapists. If there's a disease process or some process going on deep inside the body, physical therapists cannot address that. Mostly, I would say somatic pain would be more within our realm. But other kinds of pain, the sometimes even sometimes migraines do, I do see people with migraines if it has a cervicogenic, meaning if it's coming from the neck, getting triggered from the neck. But otherwise, there's not that much we can do about that. There are some pains that are deeper and I'm sure Dr. Vinod, this would be a better sort of question for Dr. Vinod.
One of the questions that you'd mentioned earlier was, is all pain psychological? No, it's not. But the pain has a physical component and a psychological component, and we need to address both rather than isolating one versus another. So sometimes it is purely physical, but then emotions get attached and connected to it. Sometimes our own emotional state can vary the intensity with which we experience it. What we can do apart from um, medication is, of course, some things that I wasn't able to talk about today is cognitive behavior therapy, which is very useful in managing pain. And there's been a lot of research to show that. And then, of course, as Dr. Vinod mentioned, and is mindfulness meditation. So the interesting thing about mindfulness meditation, as opposed to any other, is that we sort of learn to be a witness to our pain rather than over identifying with it, and that is very helpful when we are not completely fighting with the pain or getting over involved with it. Another piece that is important is to um, you asked is when to know how to reach out to a therapist. Well, so when you do practices of meditation and mindfulness, you do develop an ability to be self-reflective, and attending to one's mind and one's psyche and one's emotions doesn't have to be with a psychologist or a therapist. It can be in other ways. It can be through mindfulness, it can be through self-help, through support groups. But if upon all of that you find that the pain is still persisting, and someone suggests, maybe your primary care physician or a friend or family member, or if you notice an association between certain life events and the pain intensifying, then that's a good idea to seek out help. For instance, someone saying that, I've been feeling very, a lot of pain for past 1 year, and then you can find out that perhaps some life event happened at that time that has intensified it. So attending to one's emotion and psyche doesn't have to be with a therapist, but yes, that is an option that can be explored.